Good day, everybody. Hi, it's Candace, your practice competency manager at the NHPC. Welcoming you back to another of our NHPC speaker series in our Facebook Live event. It's been a few months since we've seen you, so it's nice to be here today, coming to you live from NHPC World Headquarters in Edmonton, Alberta, Canada. And I have a special guest today. This is exciting. So I'm very happy to have with me Paul Donovan. I know a lot of you members have spoken with Paul at some level, perhaps with a concern you may have, or you've interacted him in some way. He's well known to many of you, I'm sure, and he is our Government and Industry Relations Director, and he is here today. We're going to be talking also with Rubena, who Paul's going to introduce us to. We're going to be talking about that ever sort of ongoing search for the perfect job, or the location or the environment where you're going to do your best work, where you're going to flourish, where you're going to grow the type of career that you want. Not just pay the bills or just sort of get through to the end of the month, but something you're really going to thrive in and do your best in and enjoy this. At NHPC, we want to help you as much as we can along this journey. And we hope that some of the information that you get today will help you, whether you're starting out, whether you are thinking that maybe it's time you make a change. I think you're going to get something out of our presentation today. All right, so I'm going to turn over to Paul, and he's going to introduce our special guest today.
Sure. Thank you, Candace. And I will note that when it comes to my role in government and industry relations, that there is that kind of new added piece of providing some guidance and resources to our members and finding, potential employment opportunities. So this is a really good opportunity for us to have our, special guest today to really discuss this topic, as Candace has mentioned. So we do have today Rubena Borg, who is from Massage Addict. She is their professional development manager, but she's also a registered massage therapist in Ontario. So I'd like to introduce you, Rubena. Tell us a little bit about yourself, your background, and the health and wellness industry for us today.
Thank you so much, Paul. It's so nice to be here, and hello to everybody that's joining us. As Paul mentioned, I am a registered massage therapist. I am based in Ontario, and I was registered in 2016. So I'm currently in my 8th year of practice. It was actually my second career. So I love that Candace said, if you're joining, maybe it's something that you're thinking to change into. I am one of those people. I dropped my corporate role and I decided to go back to school to become a massage therapist. So that was one of my dreams fulfilled. And I've been working for Massage Addict now since July of 2022 as the professional development manager. So a major part of my role is partnering both with schools and associations such as NHPC. And I speak on what practitioners, what their career path could look like. And of course, opportunities in our clinics across the country, but making sure to almost give advisory details as much as I can to show what you can do as a practitioner in one of our clinics, which are multidisciplinary, and again, just on your own. So it's great to be here to talk to everyone.
That's great. I just noticed I was mute there for a second. Massage therapy was a second career for myself, also leaving the corporate world for a change where I wanted to, be more of a helper for people, and more of a nurturer, and certainly have really enjoyed the switch. But that was a little while ago, going close to 25 years now. So been a therapist for a long time. So let's talk a little bit about whether or not it's important for you to have a resume. Now, everybody knows that you've got this skill now. You've graduated from an institution that's provided you with all that entry-level competencies that you need. You've got your 2 years of training. Now what? Is it important, do you think, Rubena, to have a list on your resume of these are all the different types of techniques I can do, or these are the different types of skills in my toolbox I can bring? Do they need to have transcripts listing what their marks were in certain things? And what do you think about that sort of stuff from your point of view?
think it is important to have a resume. A lot of companies, including ourselves, what we do is you're going to be submitting resumes online. So what we do on our end and what a lot of clinics would absolutely be doing is their due diligence to make sure that your education is listed, that you've completed your education. In provinces that are regulated, they're going to check if you have your registration with the regulatory body, of course, and if not, are you a part of the association? So of course, the criteria that's required by province should always be listed. When it comes to, education, definitely put the school where you were and the length of the program. It doesn't necessarily have to be course by course, because now when we're having national accreditation standards that are going on, we know that everyone's going towards the same goal on how you're going to be getting educated. But the school is nice to know, because there may be connections there. So you may have somebody in the field that you've worked with before. As you know, Candace, very well, it's a lot of word of mouth and we're very involved people together. We really work well together and collaborate together. So, listing a school is great. And that also goes with, reflexology certification. Are you certified with a specific association as well? When it comes to hands-on, there's not a lot of experience that you can really write, because you're not necessarily working as a practitioner. You could always list specialty clinics. So if there were any specialty clinics that were of a great focus to you, because we can't have a specialization as a practitioner. So maybe it's manual lymphatic drainage, or you've done something with sports therapy in a specialty clinic. If you're in a school environment for that, I would absolutely list those kind of as your work experience on your resume.
Yeah, I agree. I think it's any volunteer opportunities as well that may be relevant, working at an event, volunteering at a geriatric care home. All these things are all going to help in your development of your skills. So it's important. Everybody wants to know. Yeah.
Absolutely. And I think that even if, for people who've been practicing for a while, you can put things where you've had those additional modality trainings too. So for new students that are coming out, it's the basic resumes, but make sure, any continuing education, listing your courses, absolutely. Things that you would want to have, your interests.
Sure. One thing I wanted to ask is how do you verify that somebody is, a member of a professional association or college? How would Massage Addict do that? Do they make a phone call? Do they ask to see, somebody's membership certificate? How does that work?
So what we do prior to sending any information out to our clinic, so the department that I run, the PD department, we actually will go to, for example, in Ontario, we would go onto the CMTO registration list to see if they are registered and when they pass their examinations. If it's somewhere in Alberta where you're not regulated at the time, you can find them through associations. If we can't find them online, we will call and do our due diligence that way. And then when you're coming into the clinics, we do ask for proof. So we're going to ask for proof of your either your registration certificate, your association certificate. Absolutely, we're going to look for your proof of insurance to go with that. We would not need to have it, we wouldn't need to keep it tangible, but for insurance, everything is done through e-files now. So as long as we have that in our clinics to make sure that you can give that safe and effective treatment, absolutely.
That's right. Yeah. And all NHPC members can, access through our online portal on their own profile and download their, certificate of insurance or the certificate of membership, and what their limits of their liability insurance are and that sort of thing. So it's no problem to provide that to your employer. And I
Perfect.
think, if everybody wants to know, I tell our members quite a bit that, having this liability and malpractice insurance is like driving a car. You can't drive a car without insurance. You can't practice without this. And we hope to goodness you never have to access any of these things, but this is the world we live in. You need to have these things in place. Okay. Now,
so we do is for the safety of it's for the safety of the public, right? So having that insurance is also for the safety of the public, for sure.
Yeah. It mitigates the risk sort of for both ends. They're protected and you're protected as well. So it's just a necessary evil, I guess, as you say. Even though the risks are very low and our fees for liability and malpractice are low in the industry because of the low risk of harm. So that's a good thing. Is there, if somebody is applying, no matter what they practice in a clinic with Massage Addict, would they have to do a sample of their treatment or a practical, 15, 20-minute massage or demonstrate their skill that way? Is that usually part of your process?
Yes and no. So a lot of the times, if we have about 25% of our clinics are actually owned by practitioners, so we want to, of course, increase those numbers. We find that more of the applicants that are going to apply to the clinics that are owned by a practitioner, that may be a component just to see what they're bringing in. On other occasions, maybe not in the interview process, but the clinic owner who loves healthcare but might not be a practitioner would partner someone with a senior therapist or a senior practitioner in the clinic, just to make sure. What we do believe, though, is by the time that you finish your education and you're going through your registrations, that you've been deemed competent. So that's what a lot of these associations are doing for you. So it's not necessary. It's not part of the requirement. Will it come up eventually? Potentially, but it's not something that's absolutely part of the interview process. No.
Yeah, well, I think it's probably, I would say in the Alberta market, I could say that it's probably, 70% of the time that you would be asked to provide a sort of a sample treatment. But, I think that is very dependent on each clinic owner and what they see. Of course, if it's a brand new student versus somebody that's maybe coming in and bringing a large client base with them, there might be different requirements or comfort levels with somebody, and so it would vary. And it's definitely not. There's no standard to it. It's whatever the whoever's doing the interviewing and the clinic owner is feels is necessary, I guess, to get a good handle on. So that's that.
I think it's also important, just to be prepared. So when you're going for those interviews, I always like to tell people to dress for the role. So if you're going in and you're going to be working as a massage therapist, you're not going to go in a 3-piece suit. You want to make sure that you're going to have something that's, professional treatment attire, because it could be, we've had all of these questions. I have a couple of, thoughts around your practice abilities, or I want to see some of the skills that you have, and they may ask you in the moment to provide a mini treatment. So make sure that you're comfortable and professional to do that. When you come into any of the clinics, you don't have to bring any of the supplies with you. So know that you're not going to have to bring in your tools. But I remember my first interview threw me off a little bit when they said, okay, so you're going to give somebody a 20-minute back treatment. I'm like, okay, I made sure I didn't, you just go in and make sure you don't have long sleeves on, and that's what you need to be prepared to do as a practitioner. So, we're never going to look at you to say you don't have a suit jacket on when you're coming in for an interview, right?
Yeah, exactly.
So,
I think, I think that's a really good point, dress for the job you want, right? So, and what's appropriate for the setting, there are, some places they might, they may have a uniform that you wear. They may have specific logoed scrubs. And I mean, that's well after the hiring process, but, carrying yourself in a, the utmost professional manner and ensuring that, you are, really upholding the entire profession when you're walking in there and making a good impression. I mean, you obviously want the job if you've applied and you're going in for an interview. So we hope that you'd be ready sort of for anything that comes down. It can be a little daunting too. I know, for some to, on the spot, maybe just provide a treatment or feel confident doing it. And it's not your environment, so you're not sure that table height and all these sorts of things can be going through your head and you get nervous, but you've got the skills. You guys, you've got it. You've already, graduated, and you've got, you're ready to go, and you've been working with the public somewhat already. So this is it. It's time to jump in sometimes in the deep end and let her rip.
Yeah, for sure. I tell everyone, just trust your hands. They know what they're doing.
Yeah, they do. I know, it's something that happens is when you think back about, record keeping, for example, it's like, well, my hands just do it. I had to really stop and think about what I was doing to be able to get off my hands onto paper or onto online about what I was doing during a treatment, because your hands do definitely just take over and it becomes so instinctual, and it's a real beautiful thing. Let's talk about something that is sort of, it can be a little thorn in my side. The whole, I could never work at a spa because I'm not that kind of a practitioner versus working in a massage clinic or a multidisciplinary clinic or that kind of thing. To me, there is no different in how you approach your treatment, how you are doing, your assessment. Perhaps you're not doing a full-on orthopedic assessment, but you're not doing that full-on, full-body orthopedic assessment for everybody that walks into your clinic either versus a spa. It's still, you're still doing your due diligence to ensure a treatment should take place. That doesn't mean that you're not using some deep tissue techniques that you're I have a problem with people saying I could never work in a spa, I can't do massage like that. And I'm not wondering what your thoughts are on that. I think no matter where you are, whatever your setting is, that you are bound by professional standards through your association, through the industry, through what you were taught, that you are applying no matter where you are. I don't want people to sort of poo-poo working in either a destination place or a spa setting, thinking that it's sort of beneath them, quite honestly, how it comes across.
I find it interesting that you say that because even in Ontario, that message kind of gets across as well. And previous to working in Massage Addict, I had a little sprinkling of working in an admissions department in a massage therapy school. And I kind of wanted to change that thinking as well, because I fully believe that just as much as a client's going to find the right place where they want to get treated, a practitioner is going to find the place that fits them to where they want to practice. So I absolutely agree as well that I am representing the massage therapy profession. So I'm going to give that client the treatment that their body, the informed consent, of course, from the client, but that treatment plan and what they need to have in that treatment, 100%. A lot of the times, people look at a spa as being not as high level as a multidisciplinary clinic. And I think it's because it's just a different idea and a different setting of what it is. So normally when you're working in a spa, you're working more as an employee. So it could be more of an hourly rate. You're looking at something that is, maybe a little more difficult to have that returning client base. It might be a little more difficult to create that larger treatment plan for your client, because a spa is more of that destination well-being. I'm going there with my sisters or my friends, and I'm having that kind of treatment and environment. So I can feel, maybe that's where we need to shine light on the actual, spa versus clinic, saying that I may not have the same client and have that treatment plan. They're going to see me once a month for 6 months or once a month for a year kind of thing. And then of course in a spa, you're getting paid vacations and stuff. So you'll get your, sometimes as an employee, you'll get your paid vacations. There's benefits working in both. Absolutely.
There certainly is. Yeah, there certainly is. And I think, one thing about, I think, working in a spa, I did some time working in a spa, and I was just a sole proprietor as well. I wasn't on contract there. And, I had my own clientele that would, that would come in from, the businesses around it and that sort of thing. But what was also interesting, it was the one-off people that you're going to meet because they're in town for a special occasion, or they are traveling through and this is the time that they can have a little bit of self-care. And so I want people to realize that, perhaps a relaxation is as therapeutic as any,
deep tissue treatment.
Exactly.
Yep.
It's still therapy. If you are, if it's, something in your spa is really bordering on, pampering and body treatments and that sort of thing. That's where things can get a little iffy as far as, should this really be claimed as a massage, session or not? That's a whole other webinar that we could talk about things like that.
Right.
But, being a really, really excellent relaxation specialist, well, not specialist, relaxation massage therapist is probably, a niche in the market that might be missed. Everybody kind of wants to be, they come to me because I can beat them up and I can get the results and, cause them some pain. And they think about me for 3 days after, where, well, we know a large part of the public out there is not really looking for that. So, and again, it does, your setting really shouldn't matter. If you work in, you can have, I worked out of a gym for many years, and I had people that would come in for extreme relaxation sort of work, regardless whether there was people doing
Yeah.
heavy weightlifting outside the door or not. So
Absolutely. And I
fine.
think that, it's interesting because I've spoken to people before when I was taking additional education in manual lymphatic drainage, and she actually treated hockey teams. So you would
Yeah,
think that these
yeah.
big
The
burly
ultimate.
players, correct. And I think, I think also the knowledge of we're using Swedish massage techniques. That's what we're based on.
Right. Yeah,
But
that's right.
the relaxation massage, relaxation is just a reflex effect of any Swedish technique that we're using. So essentially, even if you're doing a deeper tissue, when you're flushing out the tissues and you want to make sure that can have that same effect to bring somebody down to, a
Absolutely.
less,
Yeah.
like the muscles into a less stressed state after a deep tissue treatment.
You're going to affect the nervous system, right? So.
Absolutely, absolutely. And I think, when we talk about that whole group of clinic and spa, the major focus on that is it's a fully supported environment. So you're going to have your clients booked for you. You're going to have your appointments full. You're going to have your receptionist and all of your linens and those things. You can have that. You can walk in and treat. So you would have that both in a spa or in that fully supported administrative clinic. So that way it's the same kind of, whether you're independent contractor or a spa employee, you can still have that same kind of idea and setup. Yeah.
Mm-hmm. Yeah, I think it's going to be finding what works for you. And, just because you've found one job, that doesn't mean you have to stay there for the rest of your life. It might not be the place that is the best fit for you. And I think that's just part of your growth in your career as, a natural health practitioner. That's just the way it is. So, don't feel that if you're in a spot that you're stuck there, and I mean, obviously there's contractual obligations, right? I mean, you have
Of
that,
course.
that's one different thing, but, give yourself some time. Don't, I guess, pigeonhole yourself too soon into what might be something
Right.
that you find that you really, really like.
And I was gonna say as well, it's if you're working for one space, like you were saying, don't pigeonhole yourself into one spot.
Yeah.
If you're working in a place, make sure that there's no there's no competition. So make sure you can work in 2 to 3 or 4 different settings. So
That
maybe
is a
you want to
good
have
point.
one day at a spa. Maybe you want to have 2 days in a multidisciplinary clinic.
Mhm.
Know that as a practitioner, when I was a student, we always had a saying, it was just keep calm and effleurage on. So it was just something that you just needed to get through. But it's you could have 2 days working in that multidisciplinary clinic where you're seeing these patients that are coming in or clients that are coming in that want the deep tissue. Maybe you have one day that you're a mobile practitioner, have table, will treat, you can go see someone. But then you can also be in a spa and you can have those benefits of that, and you can have everybody coming in. So know that as long as because you can own your own contracts, and you can work in a variety of places at the same time. So that's also an option for sure.
Yeah. And I think, that sort of having the, I guess the courage or the self-confidence to handle, that sort of situation or negotiating on your behalf, that comes with time. I mean, don't be too hard on yourself, where you have to start somewhere. And I think I know with some new folks, they might feel a bit discouraged if they're not, making as much money as they thought they would, or as the school maybe taught them they would, or told them that they might, right? And it's not bad to hold on to a part-time job in quote your old world or the other world or whatever you want to call it, if it's going to help you, stay less stressed, pay the rent, put the food on the table. Don't feel bad about not completely jumping into this if it's not if it's not just going to work for your particular situation. There's just nothing you can do about that, right?
Absolutely.
Yeah. Well, let's talk about that other thing that a lot of people every once in a while they look at those books and they say, wow, I'm giving this clinic $2,500 a month to work here because they take, 40% of this and they take a fee for that and all that. If I was working at home, I'd keep all the money. Well, that's on paper, that looks really, really good, but let's face it, that doesn't always translate. Not everybody will come to your home. Not everybody is comfortable doing that. It might be on the other side of town and, you were right by the kids' daycare. Who knows what? For whatever reason, they may not be anchored enough for you to follow you wherever you are. So, what sort of challenges have you gone through, transitioning from one clinic to the next, or perhaps, working at home, or, what sort of, what can you talk about with that?
Absolutely. So I think, the number one thing is if you're working in a space that does have all of that administration for you, you really now you have to start balancing your time of treatment and then your time of working. So when you have those administrative and someone who has a front desk team, they're going to be cashing out your clients. They're going to be booking the appointments. They're going to do those phone calls to say, confirming that you're coming in tomorrow. So you have to make sure that you're going to have time to do that as a practitioner on your own.
Exactly.
Of course, time for charting, that's something that you have to do regardless of where you are. But again, that's something else that's going to add on. Finding clients, you're not going to be able to start right away with 100 people on your client roster that you're going to see continuously. So it's, again, more word of mouth, making sure that you can find those people. And how would you do that? So that would be the cost of marketing yourself.
Yeah, exactly.
How are you promoting yourself, which is, in a clinic that most of the time that's included in these costs that have those splits, or that money that's going into the clinic base, that they have marketing that's included. Of course, it's where also you're going to be practicing. So, if you're practicing in your home, you have to think of your own home sanitization. You have to think of people's comfort coming into your home, or you even having the comfort of people coming into yours.
With licensing, all kinds of things.
Exactly. Licensing is a big one. People think that you can just open up the door, but you can't. Are you allowed to actually treat in the area of the city where you are? If you are a mobile practitioner, same thing. It's your car. You're going to have to do maintenance. You have to carry your table. You never have the same treatment space twice. So there's a lot of things that you're going to have to take into consideration. And of course, it's the collaboration. So you become a true independent contractor. So how are you maintaining a relationship with your colleagues and your community of therapists and practitioners that maybe you've had before in a clinic, and having those conversations? So it's something that could, it can still happen, but it's just a different way of thinking how you can get it.
Yeah, I think that it's tough. You're excited, you want to get going, you have in your head that there's, I charge this much an hour, that translate to this much, and just the dollar figures don't come out right away, and you get a little bit nervous. Maybe I'm doing the wrong thing. Maybe I chose the wrong profession. Maybe I need to find a new job. Maybe I made 3 jobs. I mean, when I first started, I worked at 3 different clinics. Started at a physiotherapy clinic thinking there's people coming in the door there. They need massage. This is going to be great. Worked at a spa a couple days, and then worked at a full-on massage therapy clinic. And I thought whichever one picked up would be where my energy went, and end up being the full-on massage clinic. But it's just how it happened. I never was comfortable or wanted to work out of my home. I'm not that person. I like to, I love the collaborating environment. I really think that's great. I do have a question here.
Yeah, for sure.
I think maybe Paul can maybe even help answer this one. Tim is asking, would you suggest start working as a student before you're fully registered?
Would you like me to answer that, Candace?
Yeah, I would love that.
Sure.
Paul, go ahead.
Yeah, so I do know when it comes to the NHPC, with regards to practicing when you're enrolled in your program, we do require that you your ability to practice is dependent on the program itself. So if you are in a massage therapy program and you are in the part of your program, usually it's within your second year, they might have that ability to, start doing your practicum. And with some of the schools, they do allow that as an external practicum. So there could be opportunities to start working as you are a student. There may be supervision as well that is required with that practicum. Now, for other practices and modalities, we do recognize there could also be opportunities in doing that as well.
Yeah, I think that I know I'm assuming, Kim, that you're thinking I could get a head start if I started to work, but municipalities also, you need to have a business license to work. You can't get that in some municipalities unless you're you've graduated, you're a full-on regular practicing member of an association. So that can impact your ability to practice as well. And we really want you to be fully ready to get into the profession. So waiting until you've got all those skills, you've done your final exams, you're a regular practicing insurance eligible provider type membership with your association is when we really think you should be jumping into it. So I understand that there is, you want to, start earning some money. Goodness knows, tuition's very high, expenses can be daunting. You want to start getting at it, but starting work, early as an MT may not always be the best way to do it.
Yeah,
and I know in regulated environments there'll be different situations where that just won't happen, right? So go ahead, Paul.
I also wanted to note too that as you are a student in your program, your scope of practice is also much more limited. So the services that you're providing is much more limited until, once you've fully graduated and completed your program as well. So what you might be able to offer to clients or potential clients out there would be much more limited during that time too.
That's right. And, there's no issuing of receipts. They won't be covered by any insurance company. So that's also something that you need to be aware of too.
Mm-hmm.
So, yeah. Did you have anything you want to add there, Rubena?
I was going to say, so we, in some of our clinics in Alberta, so in regulated provinces, you don't have that opportunity to work as a student. In provinces like British Columbia, in Ontario, there's absolutely no opportunities for students, which is unfortunate because it would be great to have a little bit. BC's model is slightly different, where once you've graduated, you can treat until you take your registration exams. So that's a different opportunity. So we have it more so, like Paul was saying, it becomes a mentorship. So you're partnered with a senior RMT in the clinic. So it's not necessarily school supervision, but you're partnered with a senior MT in the clinic if it's something that you choose to do. And then again, just to confirm what Paul was saying, there are opportunities in our Alberta clinics to be a student therapist, but you are very limited because you have obtained only your first year diploma. I'm trying to remember the name of it. I apologize. It's not your full. It's not your full diploma.
Right.
But it's almost like in Ontario, I would say it's comparative to an esthetician's diploma. So it's more of you're doing a relaxation focus. You're not going to get your receipts.
Yep.
No one's going to be getting insurance, things like that. So we do have those opportunities. You will get more popularity, of course, as a registered MT, and then with the insurance and things like that. So yeah.
Along with it, to be a little patient, I guess. But I understand the wanting to, if I need a part-time job, I might as well try and do it in my own field, rather than Starbucks or something. I can see that being looking
and again
like a good way to go.
A lot of opportunities as well. So we have opportunities for students. Any practice you're going into, reflexology, massage therapy, even acupuncturists, if you want to be within the field, we have front desk teams. So you can be within that world and you can still make money and you can learn what it's like on the back end, how to run a business. So if that's something that you wanted to be involved in.
Very important skills.
Yeah. You can join, you can still join that community. You can meet the practitioners. You can meet your future clients sitting at the desk. And then that way you can have that communication with them as well, still make some money, you can still go to school. And then it's almost a seamless transition. Once you go ahead and get your registration, you already have a place to practice. So it's just that blend right in. So there are different opportunities to still stay in that realm of healthcare that are not necessarily treating clients as a student, but still making some money. So yeah, you can do that as well.
Right. What is your thought? I know I always enjoyed working in sort of a more collaborative setting, at least where there were other MTs to talk to. I find, practicing in isolation can be a bit, you don't have that water cooler talk with anybody, or that, you really have to seek out to, connect or network and things like that. So I enjoyed working in a space with other MTs and with other healthcare providers like physios or chiro. And what are your thoughts on that? Did you find that helpful, or was that a space that you like to be in?
Absolutely. So even with me, I've always practiced in a multidisciplinary clinic setting. You can continue your education. So it's through peer
Yeah.
collaboration at that point. Myself am not interested in becoming an acupuncture practitioner. However, I love to learn about it. I love to have a space where I can refer my clients to go to, or if it's a reflexologist, because my scope is limited. I can practice within what I've learned, but maybe I can see something that my client would be able to benefit from. So you have that collaboration in terms of referring for different treatment types. You have that, it becomes a natural sense of mentorship within the group as well. And it's kind of cool. Like you can teach a chiropractor things that you learned in school
That's
that they
right.
might not learn in school. So it's that kind of relationship and learning new tricks and
Yep.
new
True.
tips.
Yeah.
And you can take what you can. So
Mhm.
especially those who've been practicing for a long time, whether it's just massage therapy or any other practice, I say that you learn something from someone every day. So take as much as you can from the
Mhm.
people that you're with. And then it's also your own self-care. I'm very
True.
big on
Very.
bartering treatment for treatment,
Yeah.
right? So we're allowed to do that as practitioners. So it's like I'll give my chiropractor a massage and they'll give me a treatment and we'll work together, and it's something that we can elaborate that way. So
Yeah.
absolutely, collaboration is great for yourself. And then of course it's that treatment plan for clients and making that holistic approach to that treatment care. And then your clients, you're going to get
Yeah.
the most beneficial from someone who's an expert in each of their fields. So I think
Mhm.
it works really well that way for collaboration for sure.
Right. Okay. So I think we do have a question here, but I'm not sure. Um, I think maybe if Paul could take a look at that, I think that would be good. It's not really a question for everybody on the panel, so that's fine.
Sure.
I was just one more thing I wanted to talk to you about is um, the I guess what's the best thing about what you do? What's something that you were really surprised about this whole career that you weren't sure was going to happen, that has delightfully happened?
Ooh, that's a great question. So, I mean, this is something that I've always wanted to try. So I was very happy. I was supported by friends and family to be able to go back to school
Yeah.
and do it. Knowing that it would be, I mean, there's people that don't like it, but who really doesn't want to get treated kindly and feel better and have ease of movement? So that was a great thing that you're able to give people. But um, I think that the biggest takeaway and the biggest surprise that I had was, you know, just the amount of people that have never experienced treatments before. I still meet clients today that they come in and say, this is my very first massage.
Yeah,
Just
it's
because I've been
amazing to
around
me.
it.
Yeah.
Yeah. So it kind of brings you back as well, which is nice because then you're in your head, you're I'm not just saying that I'm not doing this with every client for informed consent,
Yeah,
but you're
exactly.
making sure that you're walking through step by step and really enforcing and having, if there's any questions, because when you have your regular client base, you do
Yeah,
the
yeah.
questions, they know the drill. It's
It's a little
almost
bit
like they're
different.
practiced.
Yeah.
It's a little bit different, but when you have somebody that's very new, and it's always exciting because then they leave, and when they walk away and say, I didn't know this could be so good for me,
Yeah, it's
that's
so
what
rewarding.
I truly love. Absolutely. So it's something that, you know, to continue to bring that. And only 50% of Canadians have really tried a massage, which is a little bit scary.
Mhm.
So we need a lot more massage therapists and practitioners and everybody else that's across the country. But
Yes.
yeah, it's that sense of, you know, and maybe it's not for everyone, but you can adapt your treatment for everyone. So, you know, you
Exactly.
have the
Yeah.
client saying, do I have to take my clothes off? No. Do I have to lie on the table? Absolutely not. We're here to make sure that we're going to get you to feel
Exactly.
better
Yeah.
and you
Yeah.
return to your activities of daily living. And this kind of takes us, you know, 360 back to that first question of, regardless of where you're practicing, know that you own that treatment as the therapist to make sure you're making those right decisions for your clients. So that could be anywhere you are. So for sure.
Exactly. Yeah.
Yeah.
I think that it gets forgotten that, you know, as much as you are, you know, you have more knowledge, you have the treatment ID in your head, but the person on the table has to collaborate with you. You know, you don't want anybody that's just going to say, okay, fine, do whatever you want, or fix me when you walk in the room. We're not here to fix people. We're here
Yeah.
to remind people that they need to move, that they, you know, I can help you remember what that full range feels like so that you can
Yeah.
go home and continue to move and keep yourself that way. But you know, it's definitely a two-way street, and I think it's such a nice, gentle way for people to realize that they can get back into their body from when it was that it was more less pain for them, or where it was more comfortable for them, or they felt they had more confidence in their movements, all those sorts of things that they've maybe ignored for 10 years. We can help them
Right.
kind of come back and get, you know, reminder that your body is meant to do these things, and this is a nice gentle way to get you back into your head, into your body, and you know, connect your body and your head and body
And your
together.
mind. Yeah.
Yeah, because your head just sort of floats around out there and gets through life, and then you know, they, oh, I didn't think that hurt until you touched it. Well, it's been like this for likely 6 years. You know, really, you drive a
Say the
truck,
same
your
thing.
arm is like this all day long. You know, if you had given yourself 3 minutes to think about it, you would have noticed there's a big lump in your shoulder. But you know, that's not how the world works. So, but you're
It's
right,
amazing that you've said
accessed.
it's amazing that we have never met in person, and you're in Edmonton and I'm in Toronto, and we would say exactly the same thing that every practitioner probably hears in their own practice saying, I didn't know that hurt until you touched it. It should be
Yeah.
a logo on something, so that it tends
Yes.
to happen with everybody. So that's, you know, because we tend to go through life because we have to. There's no stopping it. So we want to make sure that we can move and get back to those activities of daily living, of
Yeah.
course.
Yeah.
And another promising thing is we're seeing a lot more recommendations and referrals from the medical community. So that's such a promising thing that they're saying, go for massage, go for acupuncture treatments, go for reflexology treatments, see your chiropractor, rather than giving, you know, that prescription for a pain medication. So it's such a promising thing to see for the practitioners that are starting, and the field that we can continue to grow, but that clients are really starting to be
Yeah.
internally focused and to say,
Yeah.
I shouldn't move this way. So yeah,
Yeah,
absolutely.
yeah, I think it's great. I think that we should have, I don't know, there should be just, you know, a national try massage day. We get that going coast to coast, and just, you know, I think, you know,
Yeah.
that just the human need for touch is often, you know, ignored as well. So, you know, we've anybody who's coming into this field, there's no shortage of work, for you, I think, going forward. So, you know, it's great.
Well, it's one of the only careers that's probably 100% employable.
Ah, yeah, that's true.
Yeah.
Hands have hands will travel.
Yeah.
Um, okay. All right. So let's see. What else have we got here? I think we're okay with our questions and in our chat. And is there anything else that Paul or Rubena you'd like to join in here and ha- have your final few words to say about those folks that are out there looking for their perfect job and their perfect setting, and you know, where they can really do their best work? Paul, start with you.
I think this has been really good discussion. You know, we hit on
Yeah.
some different areas about, you know, what should you include or what should you look for, you know, when finding a job, and then also the type of setting I think is really important. What's the right fit? Some really good discussion there. Also, those misconceptions of kind of the two fields of, you know, kind of more clinic versus spa, which definitely comes up a lot. Was great that we chatted about. And also, you know, working on your own. I mean, that's a big thing that we often hear after working for someone else for quite some time. It looks very attractive, lucrative, and it certainly is, but there's definitely a lot to think about and consider when doing that. And then kind of more lastly, you know, still remaining connected with the community, whether it's in a multidisciplinary setting or being connected with other therapists, I think is really important over time too. So I'm really glad we were able to hit on all those kind of different points today.
Yeah, yeah, thanks. And Rubena.
I was gonna say, you know, if it's a great field to get into. Anyone that you're starting out, don't be nervous. It's something that people, you know, we love treatments, human touch. We love to get massages. And if you have any concerns, reach out to a senior RMT. Walk into a clinic where you know, people are there to help you. You can walk into any clinic and say, hey, listen, does anybody have time? Let me buy you a coffee. How was it for you when you started? We always want to help. Candace, as you know, we talk to everybody, and we talk to strangers, and we talk to our clients that we've seen for a while. So
Yeah.
anyone in that community is super helpful. So if you're unsure of something, it doesn't necessarily have to be such a formal mentoring partnership, but you can always go into any clinic. Of course, everyone is always welcome into any Massage Addict clinic, but you can go in there and ask for a tour and see what it's like, and see if you can speak to a therapist and just pick their brains, right?
Cool.
Say, can I give you a
No.
treatment? Give me some tips and see if it's something that'll work. And that's what we're here for, is to help not only elevate healthcare and holistic healthcare and natural healthcare in Canada, but it's to help each other and to grow
Yeah.
the field. Yeah. And to grow the knowledge for the public. So absolutely. We're
Yeah.
there to
Well
help
said.
everyone.
Yeah, we're just a bunch of helpers trying to help.
That's it.
Right?
Yeah.
Yeah, thank you. Thank you, Mary, very much. Rubena Borg from Massage Addict in Toronto,
Of course.
and Paul Donovan from NHPC right here in Edmonton, Alberta. And we are going to wrap it up. This is been Speaker Series Facebook Live here. Thank you very much for those that were attending. This is going to be able to, you can watch us again on YouTube. You can watch it. We'll be putting it out on social media as well. So if you just found it, or if you got called away, or you had a client in the middle of it, please give it a listen. I think you're going to find some valuable information. And again, please reach out to me at the NHPC. We can put my practice management email up in the chat box. I am open to for a chat about whatever your situation is, and also, you know, if you have some idea about who you'd like me to talk to, this is a good place and time for you to put in those suggestions. So my door is always open. Okay, remember to take care of yourself. You can't pour from an empty cup. And we certainly are a bunch of people who like to give and to overpour, let's say, right? Okay, so thank you very much. And I'm going to sign off today from NHPC World Headquarters here in Edmonton. Thanks for joining us.